Good morning students. Today we will see the second part of the physiology, give reasons. First one is the neutrophilia occurs in acute infections. What is neutrophilia? The increase of the count in the neutrophils we call it as in neutrophilia. Why it has to be increase in acute infection? Because it have a major role in the phagocytosis or the whatever microorganism which ended in our body through the various various entry methods. It has to be destroyed by the neutrophils. So the neutrophil counts will be increased when we have acute infections. Neutrophils have an important role to defense mechanism of the body from invading organisms. Hence its amount increase when the infection occurs, and this condition is known as neutrophilia. Second question, methemoglobin cannot carry oxygen. So in this scenario, we have to see what is a methemoglobin. It is an abnormal hemoglobin derivative when the ion content of the Hb is oxidized from normal ferrous state to the ferric state. That means normally in the hemoglobin, the ion is in the form of ferrous stage, but in methemoglobin it will be in the ferric stage. So what happens? It cannot carry oxygen because oxidized ferric ion cannot bind it. So that means when the oxygen is in the ion is in the ferric stage, it cannot bind with the oxygen because it is already oxidized form. So already there is an oxidized form, so it cannot be bind with the oxygen. An increase in methemoglobin result in decrease in delivery of oxygen to the tissues. So when the number of methemoglobin increases, that means there will be enough hemoglobin, but this hemoglobin cannot deliver the oxygen to the tissues. As the methemoglobin level increases, the availability of oxygen will be decreases. Individuals with methemoglobin level less than 25% is generally asymptomatic. That means a patient who having methemoglobin, that is total number is less than 25%, they usually asymptomatic. But when the percentage of methemoglobin increases, they will be symptomatic. Hemoglobin is the protein in the red blood cells and that distribute oxygen to the hemoglobin. Methemoglobin is the form of hemoglobin when it is oxidized or formed. So it cannot carry the oxygen. That is why methemoglobin cannot carry oxygen, because the ion in the methemoglobin is already in the form of oxidized form. The oxidized ferric ion cannot carry again one more oxygen. So that is why the methemoglobin cannot carry oxygen, or it cannot be released the oxygen to the tissues. The third one is pancreatic juice is high in bicarbonate. Is why the pancreatic juice is rich in bicarbonate ion. It is essential because the pancreatic juice is joined to the small intestine at the part of jejunum. Because what is coming to the jejunum? It is from the stomach. Stomach, what is the hydrochloric acid? So it is highly acidic. The stomach have a protective covering to protect it from the acidic action of the hydrochloride. But the jejunum or the small intestine does not have any protective cover to protect from the acidity. So it has to be neutralized. For the neutralization, we need a high bicarbonate solutions. So essential to protect the intestinal mucosa from the acid chyme entering from the stomach, and also the intestinal enzymes will be activated the bicarbonate medium. That is why the pancreatic juice will be high in bicarbonate. Bicarbonate is used, there are two purposes for this bicarbonate. First is for the neutralizing the acid gastric enzyme, and also second one for allowing effective enzymatic changes, because the enzymes which present in the small intestine will be active only in the bicarbonate medium. The fourth question, polyphagia occurs in diabetes mellitus. In the previous session, we have seen polyphagia is not a feature of diabetic insipidus. But in this question, polyphagia occurs in diabetes mellitus. As we have seen, in diabetes mellitus is a condition where the insulin cannot, the bicarbonate cannot be, the carbohydrate cannot be stored because there is no insulin. The carbohydrate cannot be stored as the form of glycogen and can be utilized for the later use, because there is no later use because of lack of insulin. So what will happen? Whatever carbohydrate in the body, it will be utilized. fast and cannot be stored. So when we have a need, the tissues lack of insulin. So that is the thing when we feel appetite. That is why polyphagia occurs in diabetes mellitus, because of the glucose converted to glucogen and stored in the liver, and afterwards when the blood sugar level fails the glycogen, the liver is converted back to glucose. But when it is regulated by insulin and glucagon. So, absence of insulin, the glucose is used by the body tissues, excess cannot be stored. And this leads to polyphagia. When the body tissues lack of glucose, it sends by the nerve tissue, and it relays the message to the brain that we are feeling hungry. Diabetes mellitus causes disruption in the body's ability to transfer glucose from the food into energy. Intake of food causes glucose levels to rise without corresponding increase in the energy, which leads to a persistent sensation of hunger. The fifth question is, near point recedes with advanced age. The near point is the nearest point within the eye's accommodation range at which an object can position and still form a focused image on retina. The near point of most people recedes away due to the weakness of ciliary muscles in the eye. That explanation of this is power of accommodation of the eye usually decreases with aging. That is why there is a weakness of ciliary muscles, and both will lead to receding of near point with advanced age. So gradual weakening of the ciliary muscles in the human eye decrease the flexibility of the eye lenses. RBC does not have nucleus. All the tissues, all the cell in the body have nucleus, but RBC does not have nucleus. Why? The red RBC are produced in the bone marrow, and they have a nucleus when they initially produced. In the initial form of RBC, there is a nucleus, but later they lose the nucleus in order to accommodate more hemoglobin so that they can transport more amount of oxygen, because nucleus is the biggest component of a cell. So if we remove the nucleus from a cell, it have more space and it can carry more oxygen. The primary function of the RBC is to carry more oxygen. So when the nucleus is removed, it can carry more oxygen. That is why the RBC does not have nucleus, but still it is considered a cell. Mental retardation occurs in cretinism. What is cretinism? Cretinism is the disease caused by hypothyroidism. Hypothyroidism is called as a cretinism. Thyroid hormones are crucial for brain development and influence of the brain function. Hypothyroidism leads to impaired development of growing fetus and leads to mental retardation and stunted growth. If the mother is having less hypothyroidism, the thyroid hormones which will be transferred to the baby also will be less, and this thyroid hormone is very crucial or very important for the brain development and influence of the brain function. So if a fetus deprived of the thyroid hormone during the fetal life or in the early infant stage, it may lead to mental retardation because the brain growth is not in proper way. That GFR decrease after nephrectomy. What is GFR? GFR is glomerular filtration rate. What is nephrectomy? Nephrectomy is the removal of the kidney. One of the kidney if you remove. So it is understood that when the one kidney is removed, that means if you have both the kidney are there, the amount of GFR will be high, and one kidney is removed, the GFR will be decreased because of the loss of kidney mass. So nephrectomy is a surgical removal of the kidney. Nephrectomy is associated with acute and significant drop in the GFR due to immediate loss of renal mass. That intrapleural pressure is always negative. What is the intrapleural pressure? Intrapleural pressure is the pressure in between the pleural cavity, and negative pressure means less than the atmospheric pressure. We call it as a negative pressure. Intrapleural pressure, that is the pressure inside the pleural cavity surrounding the lungs, always negative. That means less than atmospheric pressure even while exhaling. During inspiration, the volume expands and intrapleural pressure drops. This pressure drops decrease the intrapulmonary pressure as well, expanding the lungs and pulling more oxygen to them. When the intrapleural pressure is always negative, only the atmospheric air can come inside the pleural cavity. and this prevent the lungs from the collapsing. Otherwise, if it is small, the air will move in the area having low pressure and may cause in the collapse, atelectasis or collapse of the lung, or even no proper breathing can be takes place. Increased excretion of fat in obstructive jaundice. Bile is a, Bile is a fluid that is made released by the liver and stored in the gallbladder. The bile helps with the digestion. It breaks fat into fatty acids which are taken by the digestive tract. You may wonder why I am talking with the bile when they are talking obstructive jaundice. The jaundice is caused by there is an increased bile, and there will be a means forming the conjugated bilirubin amount will be and going to be increased in case of jaundice. Jaundice is the yellowish discoloration of the skin caused by the deficiency of the bile, because bile is in the gallbladder. From the gallbladder it has to go through the just to go to the small intestine, to the part of jejunum. But when there is an obstruction to that tract, that canal happens, there will be bile will be stored in the gallbladder, but it cannot be utilized for the cells. So obstructive jaundice is a condition with there is a blockage of flow of bile out of the liver. This results in the redirection of excess bile and byproducts into the blood, and the bile excretion from the body will be incomplete. So that is the reason why there will be increased secretion of fat in case of obstructive jaundice. Bile is the one which helps in the absorption and the digestion of the fat. Hope it is clear. The remaining portions we will see in the next session. Okay, thank you.